light the lamp to honor the past, embrace the present, and illuminate the future. Where there is darkness, there must be light. We were there in problem, and there must be a solution. We all pray to keep our spirit high. May I request Dr. Gavande sir to please felicitate Dr. Vasanti Kelkar madam. May I request Dr. Deepak Bode to please come. Please felicitate our esteemed faculties. May I call upon Dr. Kala Ishwaran madam, our program head. And madam had given me a lot of inputs. Thank you so much for all. I would like to call upon Dr. Saurabh Balde sir. Sir came all the way from Nagpur with all the hurdles for the airway. May I request Dr. Sahita Kulkarni madam to please come on the stage. Now I request Dr. Sujit sir to please enlighten on Ozone Learning Academy.
माझे पीजी गाईड साधना कुलकर्णी मॅडम इथे आहेत आणि त्यांनी जे काही 3 वर्षात शिकवलं त्याच्यावर पण काहीतरी ऍड करावं. मॅडम जसं साधना करतात तसे आपणही करावी. दॅट्स वाय वी स्टार्टेड 2 years बॅक मॉर्निंग मीटिंग्स, academic meetings. Initially those were held on Thursday, but because of the cases timing we shifted to Wednesday, and since last 2 years we are regularly conducting these Wednesday academic meetings. Many of anesthetists from Aurangabad and outside Aurangabad, they are attending. We got very good response and support from MGM Sahita Kulkarni madam, Headgear Hospital, and everybody in Aurangabad. And apart from conducting this meeting, we tried to post these activities on YouTube so that everyone, those who are able to attend, those who are not able to attend, can listen these very good talks. Fortunately, almost 110 or 12 videos we have uploaded. The residents can take the advantage of these videos. Many times we are not well acquainted, or suddenly we'll face a case like a pacemaker. So there is not enough time to refer the literature, and now to keep the pace with the evidence has become very difficult. So I think with these academic meetings we are trying to get acquainted with the new knowledge, new techniques, and even sharing of experiences also makes a lot of difference. So I request everyone to subscribe and listen to these talks. We were fortunate to have Bala Venkat sir, then Diwatiya sir, and many more stalwarts on this Ozone Learning Academy for these meetings. I thank my own team members and everyone from Aurangabad and outside Aurangabad who have supported since last 2 years for this academic meeting. We are close to 100 consecutive meetings. The last was the 98th meeting. There are 2 more to go, and I'm sure that we will continue this academic program for many more years, because learning will continue till the last breath. We take degree from our colleges, but true learning starts in our practice. So I request everyone to attend and support this activity. Thank you.
Thank you so much, sir. With the audience in the hall, I request everyone to take up your mobile, start the internet. Just click a button for Ozone Learning Academy. Please do it start. This is the only thing which we can offer to Sujit sir. And please like, share and subscribe. Once it is done, show your mobile upstairs. Then I'll proceed the program. Yes. Please start your internet. That's it. Everybody's hands up once you are done. That is the only token of appreciation which I can offer you, sir, I guess. Done? Tick, tick, one. Okay, thank you very much. We proceed with the inaugural ceremony. I request Dr. Sadhana Kulkarni madam to say a few words.
To have such a wonderful workshop at Aurangabad for the first time. And I congratulate all the team and all the faculty also for the same. The topics which are chosen, they are really of the practical help, not only for the residents, but even I learned something, some few things today, because the knowledge is always changing and you have to de-learn when you want to learn something. So this was a message for me today. The things which we were doing when we were residents, it's far much more ahead. We stopped intubating attempts when there was cardiac arrest and when there was cyanosis. And now even we don't see cyanosis during intubation. That is, I think, the pulse ox which has given us all the benefits. And the new gadgets which are there, they are really helpful. But only I want to say a few words regarding this. There may be plenty of gadgets, but be familiar with what you are having and keep all the gadgets at one place, like a difficult airway crash cart, because the laryngoscope is at one place, the bougie is at another place, and when there is difficulty, everybody starts searching. Please put everything together and plan, as since morning we are learning that the planning is the most important thing. Not only plan A, but A, B, C, D. We had, I think Dr. Parsandikar was there. There was one case where the bear bite was there and all the right cheek was not there. And I gave proof of all and passed bougie and intubated. He asked me, what if this was not possible? I realized that I was at fault. Plan B was not ready. But fortunately it was, the tube went in and everything was normal. But I didn't think of plan B. So I always thank Dr. Parsandekar for making me aware for plan B. And I am sure all of you will have a good take-home message that it is the oxygenation which is more important than ventilation or anything else. Please remember this, because the brain is the most important thing, which after anesthesia the patient must have normal brain. There is no use of any vegetative life. And I am sure all of you are well aware and make use of all these gadgets here and learn again and again. Practice makes the man perfect. And always after 3 or 4 months there is decay in the skill, and unless you practice it repeatedly, you can't be updated yourself. And now there is no excuse for anybody that you don't know anything. You have to keep pace, and the knowledge is expanding so rapidly that it's really difficult to keep pace of all these things. But at least you should be aware that these things are available, and if it is not with you, you can refer the patient to other hospital. Thank you, and I congratulate all the speakers. All the lectures were really excellent, and they were of the practical help to everybody. Please make use of all these gadgets and don't hesitate to ask anything, because all these our faculty is so nice that I am sure that the residents can definitely make use of it. I congratulate again all the team and all the participants for the same. Thank you for giving me.
Thank you so much, ma'am. This was really motivating and inspirational address by you. May I request Dr. Vasanti Kelkar, madam, to please give a short address. Madam is my teacher from MGM. Madam is professor at Anesthesia Department of MGM. Madam have worked as an honorary secretary in the COVID pandemic period, and she handled the team task wonderfully. For today's workshop as well, madam had given me a perfect guidelines, and when I was in a low mood, madam had boosted my mood and allowed me to work more. Thank you so much, ma'am.
Thank you, Sujata. As we are running behind our schedule, I am not going to talk much, just few lines. Securing an airway is a most important skill that is taught during our residency. And as Dr. Balaji said in his lecture, that unanticipated difficult airway is the nightmare in our practice. So there are we should be able to handle these difficult airway situations. And there are newer and newer gadgets coming into practice. And we are not well versed with these gadgets. So we should be learning about these gadgets before we practice on the patients. For this purpose, we have organized this workshop. And I am really proud of my team and Ozone team, especially Dr. Sujata, for her tremendous efforts during the organization of this workshop. And I especially thank Kala Madam for her help during the organization of this workshop. And I really hope that this hands-on workshop will be helpful, especially to the residents in learning the newer intubation gadgets. Thank you.
Now, SAM's president, Dr. Balaji Asegaonkar, sir. I'll introduce yours to sir as an director of an Ozone Anaesthesia Group. To start with, sir, was only 3 members over there, Dr. Pramod Apsingekar, Dr. Balaji Asegaonkar, and Dr. Sujit Khade. And I'm very proud to say that today we are 32. And I'm really surprised to the sir's skill of multi-talent, multifaceted, and multitasking. He's all the time keeping a big smile on his face. This is something to learn from sir. Please address at today's gathering.
Respected Sadhana Kulkarni Madam, President of AA, Dr. Vasanti Madam, my dear friends. First of all, congratulations for Aurangabad Anesthesia Association and my Ozone colleague, Dr. Sujata, Sujit, everyone has taken a tremendous effort to organize workshop. To organize a workshop at this scale is not a joke. It requires a lot of efforts and background work. And from last 1 month, they are taking untiring efforts to organize this. My role is very minimal, as Sujata is described. Like that squirrel, खारीचा वाटा माझा आहे, पण त्या खारीसारखं अननेसेसरी अटेन्शन सारखं जायला लागलं तसा माझा रोल आहे. त्याच्यामुळं मेन रोल बिहाइंड दिस इज सुजाता, so I appreciate her efforts. As far as ozone is concerned, as already mentioned, we three, myself, Dr. Pramod and Dr. Sujit, has started this Ozone Anaesthesia Group way back in 2002, means almost 22 years back. And very soon Dr. Vijay Donde had joined us. Right now we have 33 members, and we have expanded even in critical care division. We have our 2 physicians with us. They are looking after critical care division. Somehow we have managed to create our own office, small conference hall. And over a period of time, we realized that this is not the era of isolated anesthesia practice, because there are multiple disadvantages when you are alone. It is a lot of stressful job. It's a very demanding branch, and chances of complications. There are very less chance you will learn when you are working isolatedly or you are working alone, because you are attached to 1 or 2 branches, maybe orthopedics, gynecologists. But when you work in a group, you are exposed to multiple hospitals, multiple situations, multiple cases. And when you work in a group, you are in autopilot mode. Means someone in group is doing something extraordinary, something different, and you also tend to do it. So it's on autopilot mode. You start learning something new, and it's a self-development occurs through the group. That is what we have realized over a period of times. So many residents sitting here, I will advise them to better to join some group or institution, at least in initial phases, so that you will become a good anesthesiologist, or you can groom yourself as a good anesthesiologist. As far as Ozone Learning Academy is concerned, I must appreciate the efforts of Dr. Sujit Khade. Arranging activity every week, it's a very daunting task. Even it is a Diwali holiday or whatever, he used to arrange activities from a distance when he is out of station also. That is one part. But editing that, whatever has been spoken or whatever presented, it's again very difficult task, and uploading on YouTube video. So it's a very daunting task, and tremendous work he has done, and he put it on YouTube. So I request all of you to go through it and try to give justice to his work and subscribe that channel. Last but not the least, I am very thankful to Kala Madam, Saurabh, and all my faculties who has taken a lot of efforts for presentation and going to show you different aspects of difficult intubation. Thank you very much. Best of luck for attending the workshop.
Thank you so much, sir. Everybody is saying Sujata, but it's not Sujata. I'm just the face of today's event. It's tremendous efforts taken by each and every member of AAA and Ozone. A huge round of applause for our distributors. They also extended their help. Torrent, Carlstone, Ambu, Cooks, Sonoside, and Kiran, one-man person who was responding for me for many queries. Our farmer supporter, Neon, Mr. Sainath Ramson, and Sterimain. The technical staff members, Shivkanya, Diksha, Mayur, Divya, Seema, and all the IMA staff, and also the IMA members, Shankar, and everyone. Everybody played a very important role for today's event. I can conclude the inaugural function, and will like to request you to join for tea break. After tea break, you please join immediately so that we can start hands-on session.